Hi, everyone. I appreciate you joining us today. I'm Lisa Dagle. I'm with the Ohio Senior Medicare Patrol. I'm going to let you know up front, I'm going to give out some phone numbers here throughout the presentation, so you might want to get a pen and paper. Again, I know this is being recorded, so you might be able to get them later as well, but I just want to give you a heads up. As I said, I'm with the Ohio Senior Medicare Patrol. For those that are not familiar with SMP, as we are often referred to, our mission is to empower and assist Medicare beneficiaries, their caregivers, family members, to detect, protect, and report healthcare fraud, errors, and abuse. And we do this through outreach, counseling, and education, much like this recording that we're doing today. So again, I want to thank you for being here. There's an SMP in every state. There's one in every state. There's one in DC, Puerto Rico, Guam, and the Virgin Islands. So we're all over the country. We in Ohio, our sponsoring agency is Pro Seniors in Cincinnati, but we do cover all 88 counties in Ohio. Pro Seniors has, for a reference, Pro Senior has a legal helpline. They cover all 88 counties as well. And so if you're Ohio resident and 60 years of age or older and you have a legal question, you can call and set up an appointment there. It will be a phone appointment at a time that's convenient for you, and an attorney will call you. So the first phone number I'm going to give you is for Pro Seniors Legal Helpline, and that number is 1-800-488-6070. And they are our sponsoring agency. So today I'm going to talk a little bit how to prevent medical and identity theft and how to detect and report healthcare frauds, errors, and abuse. I'll talk about how to become, ways that we can, things we can do to help prevent becoming a victim. And then if we do become a victim and fall to a scam, what do we do? What do we do next? And then finally, I'll talk about some of the scams that we've been seeing recently, some of them surrounding the COVID-19 situation, and then just a couple other scams that we've been seeing out there. As a point of reference, when we're talking about Medicare fraud and errors and abuse, we lose about $60 billion a year to Medicare errors, fraud, and abuse. So you can see what a large problem this is. And that's a cost to all of us. It will relate to increased premium costs, increased healthcare costs, and those are really valuable dollars that we're losing for Medicare services in the future out of the Medicare Trust Fund. So let's talk about ways we can do to stop losing that $60 billion a year. So first, I'm going to talk about preventing medical and identity theft. And this is really about protecting your personal information. Don't give out any personal information to anyone you don't know and trust, or that you've been referred to by someone you know and trust. And when we're talking about personal information, I'm talking about your Medicare number, your Social Security number, date of birth, address, all of those things. In Medicare, the slogan for Medicare is guard your card, and we say guard it like a credit card. And it really is a credit card for your medical services, because when you turn that over, they're going to charge Medicare for those services. So really hold tight to that. And again, don't provide that to anyone you don't know and trust, like your doctor or someone your doctor has referred you to. We also suggest that you shred documents. Anything that has your name and address on it, don't just put it in the recycle bin or throw in the trash. If you can, shred it. I know that's difficult right now if you don't have a shredder. It's hard to get out right now, and some of the local banks or community centers sometimes do shredding events, and those aren't happening right now. So you could hold on to those and then just shred them when you have the opportunity. So the next thing is okay, you've protected your information, and how do I know if I even have a problem or if there's something I should be concerned about? And that's the detect part that we talk about in our mission. We've talked about protecting our information. Now we're going to detect and see if there are any things I should be concerned about. And that's really a three-part step for what we say. The first one is keep track of your medical expenses or medical visits, your doctor visits, any lab tests you're having done, any prescriptions you take. The Senior Medicare Patrol, we have healthcare journals, and I know I've given some to Heather and some to Bonnie and Belpre. Shortly before all this happened. So you probably haven't had a chance to get any of those yet. And I know when we open up they'd be happy to provide those to you. And if they need additional ones, we're happy to provide them to Belpre and the O'Neill Center. But what the healthcare journal has is it has a place in there where you can write down when you've gone to the doctor or gotten a prescription or a lab test has been prescribed and the date. But what I also like about it is you can write in there questions you may have before you go to the doctor. So when you're there, you remember to talk about it. I know oftentimes I have 5 questions on my mind when I go in, and I come out and go, shoot, I didn't ask these 2 questions. So it really kind of helps keep that appointment on track for the things that you want to talk about. So keep track of it. Again, you don't have to do it in this journal. Do it whatever works for you, whether that's a calendar or a notebook. Again, whatever works for you, because if it's not convenient and works for you, our tendency is to not do it. But it's really important that you do it. It doesn't matter how you do it. The second step is to review your bills and your medical summary notices. If you have original Medicare and you have a medical summary notice, or you're getting explanation of benefits from an Advantage plan or maybe a supplemental or a Part D plan, look at those bills, review them. Is everything that's on there, when you look at it, do you go, oh yes, I remember that. I remember that charge. Yes, that's mine. It might not be yours. You may look at it and go, that doesn't look right to me. So then the Part 3 is to compare the two. Look at your records that you've kept and compare it to your summary notice. If they don't match, then there might be something wrong, So I have a question about my bill, what do I do? How do I know? Is it an error or is it something more like perhaps fraud? The Medicare system is very complicated, and there are many people involved in your care and in billing your health services. So this leaves a lot of room for human error. It could be just in typing an account. It could be, a transposition of an account number. It could be a coding error. You may see a name on a provider and you go, I don't recognize this name. I never saw this doctor. And that could quite simply be maybe a pathologist or a radiologist who you may not have a face-to-face visit with, but who is truly involved in your health care. Or maybe an anesthesiologist you don't remember because you've been put under right after meeting them. So it could simply be an error, or maybe it could be something a little more. It could be potential fraud or abuse. It might not just be an error. It could be more. So fraud and abuse are very similar. A lot of people say, what's the difference? The difference between fraud and abuse is intent. Intent is when fraud is when someone intentionally sends in bills or asks for fee for services that they know they're not providing, or asking for higher fees for things that they know that's not a justifiable cause. They're not providing the service that they're saying there are. So, that's kind of the detection. So we've talked about protecting and detecting. So now let's kind of talk about reporting. I see something wrong with my bill. I'm not sure, what do I do with this? What we say is, first and always, we recommend that you contact the provider, because it could quite simply be an error. And then they'll help you take care of that. If when you call the provider and they're not very forthcoming, or they won't give you any explanation, maybe then there's a little bit something more to the story. And it could be possibly potential fraud or abuse. So we want to look a little further than that. So you've detected something's wrong. You've contacted the provider agrees, oh, this was an error, we will fix it. That's great. You look for the correction. When the correction comes through, again, you need to look at your statement. When the correction comes through, great, you're finished, all is good. If you've contacted your provider and maybe they didn't give you a satisfactory answer, or the explanation just didn't seem quite what you thought it might be, what do you do then? What we would say is, if you have an Advantage plan, we suggest you contact the number on your Advantage plan card. Every Advantage plan has a fraud department, and they're very interested in keeping track of and tracking down potential fraud and error. They're a private company, and that goes to their bottom line, and so they will do investigation on that for you. If you have original Medicare, we ask that you contact us at the Ohio SMP, Senior Medicare Patrol, and so that would be me, and again, I'm Lisa, and our number, my direct number, is area code 513-458 5515, or you can call our 800 number at Pro Seniors, which is 1-800-488-6070. Again, that's a number I gave you before, but to reach me, you're going to choose option 7. And if you forget that, you can just hang on the line, and the receptionist, you can talk to her and tell her you're looking to talk to someone in the Ohio Senior Medicare Patrol. So, if you have an Advantage plan, we suggest you contact them first. If you don't get anywhere with your Advantage plan, please give us a call at the SMP as well. If you have Original Medicare, give us a call at the Ohio SMP. Let's say you've gotten a call from a scammer and you've given out your Medicare number. No matter whether you have an Advantage plan or any other plan, a traditional Medicare, give us a call at the Ohio SMP. We're there to help you through that process, what you need to do. We are not a legal or investigative service. Again, like I said, we walk you through the steps. Who do we need to contact based on your specific situation? When somebody called into you, what did they say? Did they represent themselves as Medicare or the IRS or Social Security? What information did you provide them? All those things will determine who and what direction we'll counsel you to go to help mitigate any negative consequences down the road. And then what we do with that information is, I mentioned that there's an SMP in every state, in Guam and Puerto Rico and DC and the Virgin Islands. We all feed that data into the same database so that those that are in investigative roles, the Office of the Inspector General for Health and Human Services, they can look at all that data that's coming in from all over the country. It's all in one database, and that's how they build their cases and do their some of their investigative work. Is a certain scam starting to show up? Is it in a certain part of the country? Does the provider's name keep showing up? Does a certain laboratory keep showing up? So it's really important, even though we don't do the investigative work, and sometimes that's frustrating for callers when they call in because they want results and they want to know that their case is being investigated when they call us. But it's really important because it allows for that investigation to happen, and it creates documentation of things that are going on out there that aren't right. So we do ask that you, again, give us a call. If you're not sure who to call, you've been scammed, you think you might have been scammed, you're not sure who to call, please give me a call. Again, Lisa at the Ohio Senior Medicare Patrol, 513-458-5515 or 1-800-488-6070, option 7. We are currently working from home, so you will get a voice message, but it comes in, not only do I get a voicemail, but I also get an email that a voicemail is there. So I do return calls very quickly. But please don't hesitate to give me a call, and I'll point you in the right direction and kind of walk you through it and get you in the right place. So we've talked about the protect, detect, and report. So now let's kind of talk a little bit about the scammers. How do they work and what are they're after? Knowing what the scammers do and how they come into our homes is a good way to help us think and prevent becoming a victim of one of their scams. The thing to remember is scammers are after your personal information. They may use this information for themselves, or they may sell it to someone else. They may not use it. But either way, they are just looking for their own personal financial gain based on your information. And what they look to do is they look to gain trust with you. They may call and say, that I'm from an official agency. I'm from Medicare or the IRS or Social Security. Well, of course, that makes us all stand up and say, official government agency, I should listen to this. They're looking out for me. They will may also provide some personal identifying information about you so that you think, oh, they know me, I should know them. They may have information, not only your name and address and your phone number, they may have your date of birth. They may have your Social Security number if they're looking for your Medicare number. They may have your Medicare number if they're looking for your Social Security number. Again, they want you to think that they know you and you should know them and you should trust them. They also try and get you to trust them by, I'm here to help you. I'm going to help you get better benefits with Medicare. I'm going to get additional services for you. I'm going to help you get that stimulus check, economic impact check. I'm here, I'm going to help you get a better, stronger plastic Medicare card than that silly paper card you have. again, I'm here to help you. You can trust me. So they really work to gain your trust, so you feel comfortable with them and are willing to provide information. So we caution, don't fall for that. Again, someone you know and trust. If you don't know them, don't trust them. Trust and verify. Scammers will also create urgency and fear and anxiety, and they do that. We need to act fast. If you don't do this, this might happen. Again, that gets us so we're not thinking clearly. We might make decisions that we wouldn't normally make if we weren't in a heightened sense of anxiety and fear. Oftentimes I've heard this referred to as the ether effect, like you're under the effect of the drug ether, where, when they put you under. So step back, think a minute, take a deep breath and say, does this sound right? Is it too good to be true? Do I know this person? Do I trust this person? And sometimes the scammers will even become agitated and angry with you if you're not providing information they want. And again, they're just after your information, and ignore that and just hang up on them. I say hang up on them. How do the scammers try to reach us? How do they reach out to us? We all know the phone and all the robocalls that are going on. And they're very good at making numbers look official, not only your area code, but sometimes the exchange. So your first 6 numbers may look like your phone number. So you think, oh, it's someone in my area, it's someone in my neighborhood. Excuse me. I know not everyone has caller ID, but if you do have caller ID and you don't recognize the number, don't answer it. If it's important, someone will leave a message. If you don't have caller ID and you pick up the phone and you don't recognize the person, again, hang up. Don't push, sometimes you'll hear 1 to unsubscribe or press 2 for this. Don't press buttons. And answering the call as well, that lets the caller on the other end know this is a live number. Somebody lives here. Somebody uses this number. It will create and result in additional calls to you. So don't press any buttons. Again, if you've answered the phone, just hang up when you realize it's a robocall or not someone you want to talk to. Excuse me. They also reach out to us through email. They may send something that looks like it's coming from an email address that you know. They've also gotten very good at copying logos. I know the World Health Organization and the CDC, Center for Disease Control, their logos have been copied pretty closely. But again, if you look closely at some of the emails, you can tell that they're maybe not from your friend, or they're not an official website. Again, why would the CDC be sending me an email? Why would any other official agency be sending me an email? Look closely at that, and please don't click on links. What they want you to do is click on the link. They can put malware and spyware in your computer, so then they can find passwords and things like that. So don't click on links from emails you don't know. Sometimes scammers will even come door to door. And again, for any time, whether you think they're a scammer or not, if someone comes to your door and you don't recognize them, you don't know them, just don't answer the door. And then we all get lots of mail and see commercials on TVs for things that we go, wow, that sounds too good to be true. And usually they are. A couple things to keep in mind when scammers do reach out to us, and they have maybe gotten, we are on the phone with them, or we've gotten an email from them, things like that. Just some points to remember. From Medicare, Medicare will never contact you for your Medicare number or other personal information unless you've given them permission in advance. You've contacted them and said, please contact me. I have questions or things like that. If they're calling you back because you have initially called them. And again, even if somebody calls, even if you've initiated a call to Medicare and somebody calls and you're unsure about, really, is this Medicare? It's okay to say, you know what, I'm not really sure who you are, and hang up and then call Medicare back yourself. It's okay to do that. Medicare will never call you to sell you anything. Medicare does not sell you anything. So if somebody's calling to sell you Medicare, they are not from Medicare. They may be an insurance company selling an Advantage plan or something like that, but they are not Medicare. Medicare will never visit you at your home. So if somebody knocks on your door and says, I'm Medicare, they're not. And then keep in mind that Medicare cannot enroll you over the phone in a plan unless you have called them first. If you contacted them, then they can help you do that. But what I would suggest, if you're looking for help to enroll in a Medicare plan, an Advantage plan, or a prescription drug plan, I would suggest that you contact OSHIP. It's the Ohio Senior Health Insurance Information Program. That's OSHIIP. And their number is 1-800-686-1578. They are part of the Ohio Department of Insurance, and they don't sell anything, so they're unbiased. There's no incentive for them to put you in any particular plan. What their role is to be there for you, to help you figure out what plans are best for you. I think they're a really great resource. We partner with them a lot, and I would highly recommend them if you have questions about your Medicare plans. If somebody calls and says their Social Security, if there's a problem with your Social Security, Social Security will send a letter in the mail with your Social Security on it, number on it. They already have your number. They don't need you to verify your number. So if somebody's asking for your Social Security number, it's not Social Security. And they're not going to threaten to suspend your account. And again, you can always hang up, even if Social Security is calling you maybe for something because you've initiated a call with them. Again, they'll send a letter first, but if somebody calls you, hang up. You can always call Social Security back. Social Security's number is 1-800-722-1213. And you can call them and say, hey, I got this call. Was this you or not? Don't call back numbers when people call and say, this is Social Security, call me back at this number. Don't use the number that somebody's leaving. Try and get the official phone number for them. I've tried to provide some of these. Again, you can call Ohio SMP and we can provide you numbers if you need them. Or you can go to the official site for them. For Medicare, it's medicare.gov. For Social Security, it's ssa.gov. For the IRS, it's irs.gov. If you'll notice, all of those end in .gov, .gov. Those are the official sites. Those are the government sites. If it's something that's .com or .net, that is not the official site. So keep that in mind. The IRS mostly their contact with taxpayers will come through regular mail through the U.S. Postal Service. They're not going to demand certain methods of payment for taxes, such as prepaid debit cards, gift cards, or wire transfers. If anyone asks for those methods of payments, that should be a red flag to you that this is a scam. So again, debit cards, gift cards, wire transfers, you don't want to use those for payments, no matter who you're talking to. Again, that's a sign of a red flag. The IRS also will not demand immediate payment, and they're not going to threaten to bring local law enforcement to you. I know I've received calls like that. This is the IRS. You owe money, and we're going to send the police to your house. Again, they're trying to threaten me and create fear and anxiety in me so that I'll act, so that they'll leave me alone. Again, it's not the IRS. They won't do that. So again, the important thing to remember, no matter how a scammer comes into your house, whether it's a call, an email at your door, mail, through the TV, don't give your personal information to anyone you don't know and trust. Kind of the bottom line there. So now that we've kind of talked about protect, detect, and report, what to look for, how scammers try and come into our home and how they try and take advantage of us and tactics and tricks that they use. Let's talk about some of the scams that we've been seeing out there. The COVID-19, there's been a lot of confusion and conflicting information surrounding the COVID-19 pandemic. And this, combined with the shortage of personal protective equipment and testing, has really helped to increase fear and anxiety and create a scammer's playground. Like I said, they love to create fear and anxiety and heighten that because it makes us more vulnerable. Some of the things that we've seen with the COVID-19, there have been false claims for treatments to cure COVID-19. There have been claims for vaccines. There have been pop-up drive-through testing where someone will just set up a site and people can drive through and get a test and pay us $250. There have been offers for at-home antigen tests, which are the tests that show whether you have the antibodies. So you have had this disease, and so now you're quote unquote safe. There's been fraudulent personal protective equipment where they will, an internet site may say they have medical grade, and they're not. When they arrive at the door, they're not, and they don't provide the protection that they say they do. The thing to remember is that there is currently no proven COVID-19, nothing proven to prevent COVID-19 right now, and there isn't currently a vaccine. You know, vaccine development is changing daily. They're working rapidly to try and develop that vaccine. But when that breakthrough happens, you're not going to hear it from a call out of the blue. You're going to hear about it on the news, again, from a more trusted source, not John Smith calling on the phone from Medicare or from the IRS or from the CDC. Those people will not be calling about the vaccine to tell you that I have it, it's been developed, I have it, I'm going to sell it to you. When it comes to testing, there are only, again, there are only certain clinics or businesses that are authorized to perform the COVID-19 tests. And individuals need to meet certain criteria to qualify for testing. So if you have any questions about whether you should be tested, contact your primary care physician. They can help you through that. You know, do you have the criteria to meet to be tested? And then they can point you in the direction of where to go to be tested. There's also some of this information on the Ohio Department of Health's website. They list by county. You can click on, you open it up and there's a map and you can click on your county and it'll list what sites are authorized in your county for that. Again, that may be changing rapidly, but your primary care physician would be the go-to person to find out about testing. And lastly, about the COVID-19, I want to talk about contact tracing that's happening right now. You know, you may get a call from someone that says that you have been in contact with a person that has tested positive for COVID-19. This could be a very legitimate call because what contact tracing is if someone tests positive, they then gather information from that person of who they've been around in the past X number of days, and then they will go out and let those people know that they have been in contact with somebody that's tested positive. However, if a contact tracer is legitimate, they are providing you information. They're telling you that you've been exposed. They are not going to ask you for information. So if someone is asking you for information, they are not legitimate, and you know, just ignore that. Do not, again, not a trusted source. Don't give out any information to them. And then with the COVID-19, we've had the economic impact checks, which have created a different kind of scam where people are posing as the IRS, pretending to call about that. And again, what they're seeking is your personal information. And remember, the IRS initiates their contact via the mail. They're not going to call you for the first time and say, I'm calling to see if you got your check, or I'm calling for more information about your check. If you're not sure about the caller, hang up and call the IRS Treasury Inspector General. The 800 number for the IRS Treasury Inspector General number is 1-800-366-4484, or you can use the online form to report fraud at treasury.gov/TIGTA. And again, you can always, I know I keep saying it, but you can always call us at the Ohio SMP. We are really there about Medicare fraud and abuse and helping people with that, but we are more than happy to point you in the direction of where you need to go if you don't know where to go and you feel you've been a victim of some fraud, abuse, or a scam. So those are kind of the things that have crept up around COVID-19. There's a lot there. COVID-19, as I said, has created a playground for the scammers. But there are a couple of those scams I just want to briefly talk about. One of them is the brace scam. This has been around for a very long time, but we're still seeing it, and it's still getting victims all the time. What the scammers will do is they will contact you and they'll tell you that you're eligible for a brace through Medicare. Be no cost to you, that Medicare will pay for it. They may call and again try and gain your confidence and talk about the pain you must be in, and is it your knee or your back. again, good guessing. As we age, we have more pain. Good chance it's going to be our knee or our back. They're just fishing. The thing to keep in mind is they're after your Medicare number. And once they get it, they may send you braces and they may not. If they send you braces, they're most likely going to be junk, and they're going to send a bill to Medicare. Keep in mind that durable medical equipment, which is what braces are, they need to be medically necessary and they need to be prescribed by a physician for Medicare to pay for it. So what these scammers are after is simply to try and bill Medicare for something that isn't legitimate and then get paid for it. Again, if this happens and you give out your Medicare number, call us at the SMP and we will help you. We will have you call Medicare to ask for a new card. Again, one of the good things about the new Medicare cards not having Social Security numbers on them is they can be replaced now. The beneficiary has to ask for that. I can't ask that for you because they want to make sure it's the appropriate person asking for that. But I will help you through that process. And then again, we also want to create that documentation because that's how we build, help build the documentation for the cases for the Office of the Inspector General to go after the scammers that are perpetrating these scams. So again, if you get a call about braces, give us a call and we'll help you through that process. The last scam that I want to talk about, again, has been very popular in the last few years. It's genetic testing scams, and it's cost Medicare a lot of money because these are very expensive tests. Scammers will contact you offering a genetic testing that will tell you what diseases and or cancers you're predisposed to have. Again, they're preying on our vulnerabilities. You know, are we going to get sick? Are we going to get the serious disease? Are we going to die? So they're taking advantage of that vulnerability that we have. There are a lot of specific rules around genetic testing. The test needs to be medically necessary. It needs to be prescribed by your doctor. You have to have certain underlying conditions for that to happen, for it to be considered medically necessary. And then they also have to go to certain certified labs for Medicare to pay. So quite often what's happening is someone will reach out, they're gonna give you this test, you sign up for the test, they may send you a kit in the mail, somebody may come to your house to swab your cheek, you send those in, they send them to Medicare. Medicare's gonna deny them and they're gonna look to you for payment. If this happens to you, again, give us a call at SMP. One, your Medicare number's been compromised and we wanna let Medicare know that, and we wanna create that documentation. Because aside from the cost, there could be a medical cost to you as well. If let's say these tests happen and Medicare has paid for them and they've not gone to a certified lab and they're not the accurate test, you know, you may be misdiagnosed. It may not be correct. And then maybe down the road, heaven forbid, you may get a disease where you may need these tests. And if Medicare's paid for it, they may say, we've already paid for this. We won't pay for this again. So it's really important if this happens to you or you think it's happened to you to call. So again, documentation can be created to help mitigate negative circumstances and consequences to you down the road when you may need that. Again, if you feel you've become a victim of any scam or fraud behavior, particularly if it's Medicare related, again, SMP is Senior Medicare Patrol. But we're happy to help you, point you in the right direction for anything if it's not us. But so for the Senior Medicare Patrol, that number again for my direct line is 513-458-5515 or 1-800-488-6070, option 7. I also want to mention that we have a free app. So if you have a smartphone, you can download our app. It's called Ohio SMP. Again, that's free and you can download it from the Apple Store or from Google Play. We upload or post stuff to that Monday through Friday, just things to be aware of, articles, things like that. We also put on there things for Medicare, Medicare education, seminars, Social Security webinars that you can join, things like that, which we try and keep that on our app as well. Again, it's free. And as I mentioned earlier, we cover all 88 counties, so we do rely on volunteers or peer educators. So if this presentation has piqued your interest in becoming involved in this program, we would love to have you. Again, right now, we're obviously not going out doing interface, face-to-face contact and outreach, you know, but we are still doing things through email, through Zooms like we're doing now, through telephoning, that sort of thing. If you find you are interested or you have questions about it or what it might look like when things start opening up, you can call Jane Winkler, is our volunteer coordinator. And again, that number for her is the 1-800-488-6070, and that's option 8 to get Jane, the volunteer coordinator. I want to thank you for listening. I hope this presentation today leaves you feeling empowered to prevent becoming a victim of fraud. And if you do, you feel empowered that you can detect it and know how to detect it and how to report it and who to report it to. So I want to thank you again for listening. Have a wonderful day and stay safe. Thank you again.
Thank you, Lisa. I appreciate you coming. You have really given us some really great information. I also wanted to add that the O'Neill Center, we do have our social services coordinator, and that's Robin. And we also, just as well as you, we work with OSHIP as well. So if they have any questions, and they can reach out to you, they can reach out to Robin, any of those contact numbers that you listed. And thank you for providing those for them as well, because I know any kind of help is good help for them, any information that they could get. And you pretty well answered all of the questions I was going to ask. You really went over a lot of different things, and we definitely appreciate you coming on and taking your time out to educate all of our seniors here.
Well, thank you. I appreciate you having us. And again, please feel free to give us a call. You know, if you're looking for more specific information, I'm happy to provide that as well. So give us a call anytime. And thank you again for having us today.
Oh, thank you. And you have a good afternoon.
Thank you. You as well.